Well, Bill, as you know, we've been doing a lot of stories recently about why Virginia's COVID-19 testing rate continues to lag behind nearly every other state in the nation. Governor Ralph Northam says our testing in Virginia is getting better. And over the past several days, he has highlighted a couple of days where we've nearly reached his goal of 10,000 tests per day in order to safely reopen. But now we find out the Virginia Department of Health has been boosting their testing numbers by combining two types of tests that many health experts say paints an inaccurate picture of testing in the state. The two types of tests are a diagnostic test and an antibody test. Diagnostic tests are the ones that tell you if you are currently sick with COVID 19, and VDH has only put positive diagnostic tests into the positive case count. Antibody tests tell you if you may have had COVID 19 in the past. However, health experts say including antibody testing numbers in total tests doesn't provide an accurate snapshot of the current COVID 19 situation in the state. Essentially, including those antibody tests pump up the total test numbers, while the confirmed case numbers are only from diagnostic tests, which could cause the percentage of positive cases to look lower than they actually are. The head of the Richmond and Henrico health departments defended the decision.
What I last heard from our epidemiologist is that we are including antibody testing for only antibody tests that have received FDA authorization, which is a pretty legitimate way to make that decision. And then, so that's the denominator side, the total number of tests that are offered. On the numerator side, we are considering if you tested positive for an antibody test and then you have clinical symptoms that would put you into the category of a probable case, we're including those cases as probable cases.
Now, it's certainly complicated. After receiving questions about this very issue from local reporters, the VDH just today separated the antibody tests out from the total number of tests. And the governor tweeted that he directed them to do so. Now, you may recall Northam's chief of staff, Clark Mercer, vigorously defended the decision not to separate them on Monday. VDH says antibody tests make up less than 9% of overall tests. And when they're removed from overall tests, there is no difference in trends. They say the numbers still show a consistent downward trend in the percent positive of tests. And remember, like you heard Cam Thompson say, Governor Northam has said he is looking for a 14-day downward trend in the percentage of tests that are positive so that he can feel confident with reopening the state. Working for you, I'm Melissa Hippolyte for CBS 6.